Okay, so I am going to be doing a NG tube today. So I'm going to check my medical order against the doctor's orders. I'm going to look at which patient and which NG tube I'm going to be using. I'm going to gather my supplies and let's head into the room. So I'm going to put this right here. I'm going to do some hand hygiene. And hi, my name is Sophie. I'm your student nurse today. Can you tell me your name and your date of birth? Perfect, that matches, along with I would check in the computer, which everything looks good. Next, I'm gonna explain, we're doing an NG tube today. This is due to your stomach being distended. It's going to go in your stomach through your nose, and it's going to relieve you of some of that distension and take out some of those gastric secretions from the stomach. So let's get my supplies ready. Do you have any questions? Perfect. I'm gonna close my curtain for privacy. I should have done that when I first got into the room. Okay, let's get this out. This is a clean technique. It does not require sterile technique. So I have my tube and my drape, which I will use over the patient in a second. I'm just gonna set out a couple of my other things. And I totally should have put these on first. So let's put on some gloves quickly before I touch everything. Okay, I'm just gonna set that out. And I like to just get things prepped and ready beforehand. Whoa. So I make sure that it's ready to go. In there, and I'm just going to place that in the tube, set out my lubricant. This marker is used to draw the line on the tubing. Okay. Anyways, let's raise the bed up so the patient is in a comfortable working level. And I'm going to place my patient in high Fowler's or 45 degrees, so that we reduce the risk of aspiration, choking, and that they're in a good place for the tube to go down smoothly. Next, I'm going to measure my tube. Let's take this. I'm gonna measure from the tip of the nose, and then I'm just gonna let this drop for a sec. We're gonna go around the ear, and then we're gonna actually come down to the xiphoid process, which if I hold tight, that's about here. This does not have a place to draw or to look at a number, so I'm gonna draw my line on. Okay, perfect. Now I'm going to lubricate the tip of my NG tube about 2 to 4 inches down. And excuse me, but I should have grabbed this beforehand. Would have done that without gloves on. Okay, let's grab this open. And I'm just going to put the tube down in there just to make sure that it gets nice and lubricated. Perfect. Okay, I'm gonna explain to my patient that this may be a little bit uncomfortable. You will experience some gagging, probably a little bit of coughing. But just to bear with me, and we'll take it slow. If you do experience any discomfort, to let me know. And I totally forgot, let's put a nice drape over you first so that you do not have any messes on top of you. And I am gonna put this cup down here in case you feel the need to throw up. All right, so we're gonna start by putting your head up, and we're gonna go into the nose. Which nostril do you prefer? The right? Okay, I'm just gonna check those. Looks like the right is fine, so we're gonna insert that in with his head up. And once we reach the pharynx, we're gonna stop because the patient will start breathing. And we're going to ask them to tilt their head down and forward and take a drink. And then since it's a mannequin, I had to hold his head, but I wouldn't have let go of the tube with a normal patient. And now we'll insert the rest of the way, just swallowing, swallowing with that head forward. Keep swallowing. Awesome, keep swallowing, and there we are. Okay, Now that we're in, I'm going to make sure that this is closed off for a second just so we don't have any secretions. And we're going to grab a piece of tape to loosely secure the NG tube to the patient until we are secure. So I'm actually going to use the same piece of tape. I'm just going to place it here for a second just to hold it down until I know that we're right in. So for a couple of checks to know I'm right in the right place, I would have X-ray come and do a chest X-ray of my patient and make sure that the placement is correct. If during insertion the patient stopped breathing or they couldn't hum or talk, I would have also stopped, same with too much coughing or gagging, to give them a chance to get their to get comfortable again and okay as best as they can while I finish inserting. Again, if they couldn't have hummed or speak, we probably would have discontinued altogether and tried again at a different time. Since we are in, and after a chest x-ray, I'm going to take some of the gastric secretions from the tubing to test the pH. So I will grab my tube, and I'm gonna draw about 10, so I'm just gonna pull this out and hold it up. Then we'll place this in, and we'll grab about 10 milliliters. Okay, make sure to just place this back in, and it can just sit right there. Next, I'm going to come over to my area where I'm going to test that pH, and I would just put some of the secretions in here like this. And I'm going to wait 30 seconds for this to read. And I can also be looking at the secretions to see the color and the consistency. That also can tell me if I'm in the right place or not, which is just another sign. Now that it's ready, it's been 30 seconds, I'm gonna look at it and compare it with these top ones, the reds and oranges, as that shows me that it's an acidic secretion. So after that's done and I've gotten all that, I'm gonna apply some barrier cream to the nose, and I'm going to take my gloves off and do some hand hygiene. And we can take this piece off, and we're actually going to take it onto here, and we're gonna tape this to the patient's nose. Okay, that way. And that way, and make sure that it's not like rubbing up on the top or too tight. I can move this out of my way now. After that's done, we're gonna get ready to suction. So I am going to put on some gloves, some newer gloves. I'm gonna check that my suction is turned on and that it's at a regular setting so that it doesn't suction out too hard in the beginning. That can cause ulceration and injury to the patient. Once it's at an appropriate level, I'm gonna grab the suction off. I'm gonna keep it up high, and while holding this up, I'm gonna pull the blue one off, and I'm gonna connect, I don't know what this weird piece is. I'm gonna connect that to suction, and we're gonna keep that up here along with the ventilation, excuse me. So now that that's done, I can peel this down, and we're gonna make sure their gown's in an appropriate place. I can take my gloves off to secure this to the patient, and I'm gonna grab my tape's over here, excuse me, a piece of tape, and now we're gonna attach it to my patient. So I'm gonna grab this, I am gonna ask my patient to turn their head to the side, and since we have plenty of suction, we can get a little bit more room. I would pull this around and double tape it for a little bit of double strength, and then I will grab my pin and we'll pin through this, carefully through the patient's gown and back through, and to make sure that that is plenty of room, and then keep my ventilator up here as well. Okay, now that I'm done with that, I do want to keep this up just for a minute while I do some oral hygiene. So I would grab this and I would just help the patient with their mouth and their lips. I would apply some chapstick and any analgesic throat lozenges. This will go in the garbage to help keep my patient comfortable. if they had some throat irritation from when the tubing went down. Now that they are set, I'm going to clean up my garbage and put this away. This would obviously go in the garbage, and these would have to go in the garbage or be cleaned. And I'm gonna lower my patient down to an appropriate level, which is lowering the bed all the way down and putting their bed back to a comfortable position, which we don't want to go too low, so they're comfortable there. And I'm gonna do some hand hygiene, and I'll come back and do oral hygiene and stuff every 2 to 4 hours. Do you have any questions? Great, I'm gonna go document and I'm done.